open up here. Good evening, and welcome to everybody who's joining in with us on our town hall. The town hall has been open for the last 3 months, and though many things have been closed in the country, the New Psalmist Town Hall has been open. Why? Because people need information and people want information. And we, as the body of Christ, have an opportunity to bring to bear that which is the best in the community to help us share and understand what's going on. So before we do anything, would you bow with me in a word of prayer? Father, in the name of Jesus, once again, we gather across this city, state, and even country now. We come into this town hall room and we come to understand, to know, to have explained to us what is this disease that is operating among us, this COVID-19 and this coronavirus. Speak to us tonight, give us insight and understanding, and help us to leave this place today better equipped than when we came. In Jesus' name, amen. Thank you again for coming, for taking the time out to be with us. We do all of our town halls at 7 o'clock, and there's a reason for that. After we've listened to all of the bad news that has come from the news, after we've heard the refrain of the virus is going up, the streets are crowded, they want to stop rioters and protesters, and after we've heard about the sad, chilling story of murders, we come together to hear the good news that God would have us, the encouraging news of a strategy and the way that we are to live our lives and take authority in times like these. We are not pawns in someone's chess game. We are individuals. We are children of God. And so therefore we come together to understand what is the word of God for us. What is it we must understand? What is it we must do? And how can we help somebody else? Because remember, there are three things about New Psalmist. Number one, New Psalmist is a church that specializes in connections. We are a church where connections are made. Connections to God, connections to each other, and connections with the world. We are brothers and sisters who minister to brothers and sisters, and our mission is to make life better for someone else. And we are intentionally leading as many people as we can into a dynamic, engaging, and loving relationship with Jesus Christ. And that's what all this is intended to do. So let me give you just a few housekeeping things before I throw it to our moderator tonight. At the bottom of your screen, you'll see something that says Q&A. In your Q&A, I'd like you to write your questions. And we have someone who's going to be fielding your questions and throwing them into the panel. So whenever you have a question, write it in the Q&A. That's why it says Q&A, question and answer. And if you want to talk to people, write it in the chat. Like right now, you might want to welcome somebody. For a moment, you see someone else who's coming in the room. You may just want to say hi to them. And what I would encourage you to do, if you can, even now to start, for those of you who are coming in, make sure you send a text out to your friends and let them know that you've got information you'll be sharing with them. And they can go to YouTube. They can go to youtube.com/New Psalmist BC, and they can watch this right now on YouTube. They can start a watch party and watch this on YouTube. But we want them to have to be in this, to be involved in this, and to grow in this. Last but not least, men, don't forget, Friday, or rather Saturday is our breakfast, 9 o'clock. Thursday is Bible study, 7 o'clock, and prayer meeting tomorrow, 7 o'clock. Moderating tonight for us is someone I've known, oh my God, since, I don't want to really say how long we've known each other, but I'll put it to you like this. Neither one of us had a doctor in front of our name. Quiet as it's kept, we didn't have a high school degree in front of our name. But I've known our presenter for so many years, and she went on from Western High School to become a doctor, a pediatrician, now one of the most respected in our city, consults on a variety of issues. has stayed well versed in what's happening with the virus and how we should prepare for it. And she organized, along with Sister Angela Smith tonight, our town hall, because we want you to get answers. Start writing your questions in now. Start filling in your questions in that Q&A, because you have them. I'm a grandfather. I've got questions if my grandchildren can come over and spend the night. Write your question. Don't worry about it seeming too simple. Or you may say, well, it may not seem smart. Ask your question. If you want to answer, ask your question. So let me introduce Dr. Jacqueline Fulton, and she will present the rest of our panel. Dr. Jacqueline. You got to unmute, Jackie.
It's my pleasure to be on this town hall today. All the folks here are friends of mine, and incredibly skilled at what they do. I'm going to have each one of them introduce themselves so that you know who's on the panel, starting with Dr. Edwards.
Thank you, Jackie. I don't go as far back as Bishop goes, but we started out with medical school. I'm Willarda Edwards, internal medicine physician in Baltimore, Maryland, and Dr. Stevens is my partner for the last, how many years? 28 years, Theo, out in East Baltimore, and happy to be here.
Dr. Stevens. Theo.
Good evening, everyone. Dr. Theo Stevens. I've been in practice for, I guess, 28 years. Of Dr. Edwards, a long time member of New Psalmist, and great to be here to be able to dispense some of the myths and get some basic understanding about this coronavirus.
And one of our deacons.
Oh, okay. Dr. Williams.
Good afternoon, everyone. I've known Dr. Fulton for the last 7 years, and I am an adult and pediatric psychiatrist at Total Healthcare in Baltimore.
Okay. Alrighty, and we have Angela Smith from New Psalmist. Angela will be fielding the questions, and I think Joshua's doing technical work for us. One of the things that kind of impressed me was how this pandemic has shown us to be a country that's very vulnerable and interdependent on each other, but it's also shown us the inconsistencies and the inequities in healthcare in this country. I really would like to have one of the internal medicine doctors talk about the risk factors that puts the African American community at high risk for coronavirus. Dr. Edwards.
Well, it just happens that the Maryland State Health Department has been doing a weekly or bi-weekly update on what's happening with coronavirus in Maryland. And just tonight, they talked about the specific areas of health disparity with African American community and marginalized communities. And one of the things that they talked about was clearly about how racism has put more of a stressor on the minority community. And when you get stressors like that, you tend to have more illnesses as a result of the stress and the anxiety, whether you're talking about from police brutality, the issues of poor health care, not having a good job, unemployment, and then also the other things like not being in a community where you can access good food and being in a food desert. Those are all things that then make you more likely to have poor health and poor access to health care. And so what we see with COVID is that it is truly impacting the minority community where we already have lots of diabetes, hypertension, cardiovascular disease, kidney disease. And when you have a community that's more impacted by those underlying healthcare issues, then this virus definitely has had a large impact on us.
Mm-hmm. Dr. Stevens, did you want to make a comment at all about that?
Yes, yes. In addition, there are actually some specific risk factors that they mentioned. A few of them, if you're 65 years or older, because you may have compromised immunity. If you're a resident of a nursing home or a long-term care facility, lung disease such as chronic lung disease, asthma, heart disease, including high blood pressure. If you're immunocompromised, if you smoke, if you're undergoing cancer treatment, if you have poorly controlled HIV, taking steroids which impact your immune system, if you're what's called morbidly obese, if your BMI is over 40, that puts you at a higher risk, poorly controlled diabetes, if you're on dialysis, and if you have liver transplant, all of those put you at a higher risk for contacting the disease.
And
Dr. Jackie, can I ask Dr. Theo to continue on that? Because there are a lot of folk who are 65 and older, who say have diabetes or a heart condition or whatever, whose conditions are quote unquote managed by medication and say diet or exercise, but are managed and doing well. They're not exhibiting any of the problems that go with diabetes or the problems that go with heart condition. Are they still persons that are at risk, or is that a different category?
Now, one of the issues with this virus is that it's so new that every day they're finding out new things, new facts about it.
Mhm.
And so it seems as if having diabetes by itself is an immune disease. And so it seems as if you're uncontrolled and then your body's in a state of instability. And they may put you at a higher risk, but they are finding that just having heart disease by itself may be a better risk. But then there are people who have no risk that also have contracted the disease. So it seems as if those issues put you at a higher risk, but everyone is at risk. And then, of course, once you get it, then you may be at higher risk of having a more severe disease than someone else who may not have those conditions.
So it's the having it that's the issue, not whether it's managed or anything else. It's just having these other conditions that means be careful. Because I think a lot of us will say, well, I've got diabetes or I've got a heart condition, but it's managed by my medication. My high blood pressure is managed by my medication. But just having the condition makes you more susceptible probably to having a problem with the virus if you get it.
Definitely, definitely. More susceptible to getting it, more susceptible to having more severe disease that may require inpatient admission and inpatient treatment as opposed to treating it at home.
Okay.
Dr. Fulton, there's a question on the Q&A that kind of suggests that we may need to do a little bit of basics. The question is that they've read that COVID-19 is not a virus, but a bacteria. Please elaborate.
It's coronavirus is indeed a virus. It's in the name. It is not a bacteria. And bacteria, the distinction between bacteria, I'm sorry, Jackie, I jumped in.
Go ahead. No problem.
The distinction between a bacteria and a virus is, and people will be very familiar with this, is that when it comes down to bacteria, we have antibiotics that can kill those bacteria. But when it comes down to a virus, just like the cold, everybody knows, or rubella, or measles, those are viruses that we have vaccines for. But antibiotics are only for bacterial diseases.
If I can add to that, just to give some background, the coronaviruses, there are a group of coronaviruses that have been known before. There are right now 7 known coronaviruses. They're called the coronavirus because they have crown-like projections that they use to give them the name coronavirus. And there are 7 that affect humans. 4 of them actually cause the common cold. And then the other 3, one causes the COVID-19 disease that we know of now. One of them caused the SARS outbreak back in 2003. And one of them caused one of the Mediterranean SARS outbreaks. So there's definitely a virus. It's been identified as a virus. But then, sorry, just to elaborate on that, the name of the virus is called the SARS-CoV-2 virus. The SARS-CoV-1 was the virus that in fact caused the SARS outbreak in 2003. That was the first SARS outbreak. The second one causes a disease called COVID-19. So the virus is called the SARS-CoV-2 virus. The disease is COVID-19 because it was discovered in December 2019 in China.
Could you address the prefix we often see on it, the novel coronavirus, and talk
But
about why it's novel.
Now, initially when it came out, it was called the novel virus because had never been seen before in humans. So initially, in fact, in 2003, with the first SARS outbreak, that was a novel virus until they named it. So now, when they first came out in December, they called it a novel virus, but now it has given an official name, which is the SARS. SARS stands for Severe Adult Respiratory Syndrome, and we call it SARS. And so now because it's novel, if it's new to us, we just discovered it, and now it has the official name of SARS-CoV-2. But novel because it had never been seen before. It came out of China, and in 4 months has spread across the world and caused millions to die. It's like nothing we've seen before.
Before we go off of the topic of what puts people at high risk for coronavirus, Dr. Williams, is there any behavior that you see that puts people at higher risk?
Well, even one of the things we look for is people who dealing with depression and even addiction. Those, are conditions that definitely impact your immune response, and those are things that we see. As far as other psychotic disorders, we're not 100% certain with regards to what the risk factors for those are, but we do know that people with psychoses will have other comorbid conditions, meaning whether it's obesity or hypertension or other things that sort of puts them at risk. More often than not, people dealing with mental illness may have other underlying conditions, just because a lot of times if your mental health is not in order, you're not going to be taking care of your physical health. So that sort of puts you at risk as well.
Dr. Fulton, there are a number of questions about testing. How often should you be tested? If you're tested positive once, should you be tested again? Can you ask some questions about that?
Dr. Edwards, would you?
You see me smiling because the first thing I wanted to say was I had some discussion from my friends that I do hand dancing with, and we did line dancing yesterday in the parking lot. And one of the things that someone said to me was about being tested and today and paying for it. So I mean, before we get into the nuances of being tested, I just want to say that with the COVID, the CARES Act that we had, and then also insurance companies have now said that they will do the testing, and in a lot of places here in Maryland, they're covering that. So my concern is about people getting tested and someone saying that's $125 that you've got to pay me, when there should be, and I confirmed this with the health department today, and that was that COVID testing should be covered by your insurance or through the CARES Act. Just want to keep people away from the possibility of scams.
And just to interject, even uninsured people they're obligated to do the testing for free.
Yes.
Yeah.
We test at New Psalmist. We tested this past Saturday. We've been testing every other week for the last 6 weeks. It's free. You don't need an appointment. You just drive up to the site. It's the same day that we do our food for families. Mm-hmm. You just drive up to the site, and we do it in partnership with one of what's called a federally qualified health center, a Total Health Care. We're partnered with them, and they come up with their team. We're a parking lot. They come with their team. They set up. They do the testing. They test everybody who wants to be tested, free of charge. We test from 9 to 12. The average wait time may be 10 minutes. And then in about what's the day? Monday. By Wednesday, everyone will have their results. and know how they stand. So I'm inviting everyone who's on tonight, if you haven't been tested, grab your whole crew and on not this Saturday, but Saturday after next, be at New Psalmist between 9 and 12, and we'll be testing, and it won't cost you a dime.
I participated the last 2 Saturdays at New Psalmist doing testing. I just want to give some results. I think the last 2 times they've done testing, not this past Saturday, they did over 300 folks, and each time they've had 3 positives. So there are positives in our community, but not that many. But you definitely need to get tested. And folks did have questions that I'm sure Dr. Edwards will answer while they were being tested.
And we
So
can't
before
be
before you move from there, one of the questions was, where can you get testing if you don't have a car?
Walk-ups. Yeah, there are places, and what I would recommend, because it doesn't just pop off the top of our heads, is that I know that there was some at Six Flags, the parking lot of Six Flags in Maryland, that you could get, if you're asymptomatic and without a doctor's order, you can get that. So I just want to say that. But go to the health department website and I'll pull that up and give it to people before we get finished here. But if you click on their website, they can tell you where you can get both walk-up testing as well as car. And it was very important. I know several weeks ago when we had people were saying, okay, you can go and you can drive up and get this. And then people were talking about in the city, well, what about those of us that don't have a car? And there are places within the city, but I'd have to give you the website and I will look that up before.
One of the places is Druid Hill Park.
Yes, St. Louis Drive.
Druid Hill Park has it, correct. And I know the city's working on more walk-up testing because they really don't have very many walk-ups.
CVS is working on walk-ups also. They're trying to develop a network of local places, not just their pharmacies and the like, but of local sites where persons will be able to walk up and get tested.
So we can Google it then. I mean, if you don't have anything else or CVS near you, then Google it and you say walk up for COVID testing and you'll be able to find it.
Before we talk about the
2801
testing
St.
itself,
Louis
I just
Drive.
want to make a statement about testing. That's one of the reasons why Baltimore has not moved past phase 1. You have to have a certain percentage of positives. Baltimore is at 21% positives. It needs to be below 10%. And we haven't even tested everybody in Baltimore City. So everybody's sort of on the mayor's case and the health commission's case, but we have not done enough testing in Baltimore City to move. And so we do need to get walk-up testing so we can get the city moving forward.
Jackie, if I could recommend to everyone who's sharing with us, if they would put pressure on congresspersons, city council persons and the like, to release funds for mobile units for places like total health care and the like, because regardless of what we're doing now, the strategies that are being employed, are being put in place are for the mobile sectors of the community. They are not for the poor. They are not for the infirm, and they are not for the elderly and disadvantaged. And the only way for us to get better numbers for the city is to go where people are and not wait for people to come to where the city structures. All of the public housing facilities need to have a mobile unit arrive there so that the persons can come out their houses and be tested. There are certain neighborhoods that need to have mobile units just arriving there so persons can be tested. The key to this is testing.
Yes. Test. So to answer some of the questions I think that were asked with respect to when can I get my grandkids around me? And believe me, everybody has been asking that question, and family and friends.
Don't hurt us too bad.
I won't hurt you too bad, but it's all about using what we already know. First of all, if you haven't been around family members in the past, my recommendation is find out about testing. Everybody that's going to be together, whether you're going to on a vacation together, you need to find out what your status is. And then the family needs to be very cognizant of who all they are around before you guys go off to take your vacation together. So I mean, if you need to check your status in terms of COVID testing, and then also every member of that family that's going to be together needs to check their COVID status as well. Then once you have done that, and then recognize that you still need to be very careful about the folks that you're in contact with as you're going to the stores and as you're getting ready and packing up and so forth. You still are then possibly exposing yourself to more COVID after you've been tested and before you take off on that vacation. So the whole point is got to be very, very careful and cognizant of what you need to do. Social distancing, up until then, the 6 feet away, wearing a mask. I keep telling people, respect others, wear your mask. Even though you think you don't have you're asymptomatic and you don't have it, wear a mask just out of respect for those people that may be more susceptible and you don't know that you're symptomatic or that you may be shedding. And then the other issue is, where are you going on vacation? And it just happens that this evening they had something on the news just this evening, 6:30, about looking at the hotel you may be staying in or the house that you may be going to, and making sure that they've done all the cleaning, and then make sure that they leave if someone's been there the night before. A lot of hotels are now given 3 days before they will use that room again, and then making sure, or the house again, before new occupants come in there. So there are a lot of things that you need to be cautious about, but it is possibility to have that family vacation.
How about having folks over just for a barbecue? Your grandkids from Pennsylvania say.
Same thing.
Yeah.
Keep the
I think that people
recommend it, keep them small.
Yeah, that, and also you can truly have events. You just have to be cautious. And you also need to look at the ages of the folks who are going to be there. A 5-year-old is different from a 12-year-old. I mean, you can sort of tell a 12-year-old, go over there and sit down, get your hot dog, your hamburger, your whatever, and stay 6 feet apart.
Right.
So you do need to look at the ages of the children or the folks, and also the behaviors of the folks who you've invited.
So team, there's another question that highlights this a little bit further. Could our fraternity have an outdoor induction ceremony for 2 new members in September, 10 to 15 people, 30 to 45 minutes?
Outdoors?
As a fraternity person, it's the same rules. It's the same thing Dr. Evans was saying. You have to know everyone's corona status and still want to be able to keep distance, because now if everyone is negative right before the ceremony, you're probably going to be okay. If you don't know who's negative and who's positive, then you have to be careful, because having been through pledging all that previously, I know what goes on, and it's nothing that's done at a distance. And so you have to know everyone's status prior to the ceremony. And that would have to be your status pretty close to the ceremony, because again, like Dr. Edwards said, if you know your status that you're negative, you still can go out in the community and still be at risk for catching the corona again before the ceremony. Outdoors is always better than indoors.
You can also be sick and not know you're sick. So when you're asking people, you need to ask the same questions we get asked when we come to work.
Right.
Have you had a fever? Have you been around anybody? So there are questions that need to be asked, even if you've already been tested.
I look at Bishop.
I have mine right here too. So.
I'm ready now. Doc, does this have any value?
You need a mask still.
I got my mask.
I saw that a lot at the line dance outside yesterday too. People just wearing a mask. I mean, wearing a screen, but they didn't have a mask on. And I think you still need to have that on too.
Now, if I got my mask and my shield, I'm ready now. I'm
Right.
shielded up. I'm gonna ride out of here tomorrow looking like I'm going to catch bees. But
One of the problems you do have though is you have a beard, and it's very hard to have a mask fit properly if you have facial hair.
really,
Yes.
Yes.
Let me say something about the mask. There's different kinds of masks. This is an N95 mask. If you notice, it has the band on the top and a band on the bottom, and it goes on the top of the head and the back of the neck, and it forms an airtight seal. That's an N95. And because these are expensive and unavailable only for healthcare workers, many people are using this mask. It's called the KN95. The N95 is recommended by the Occupational Safe and Healthy Organization in the U.S. The KN95 is out of China, and most usually has the ear wraps behind the ear. It doesn't form a tight face seal, but because of the virus, the CDC has allowed this to be used. So this has to be a face tight. The mask that we're wearing is more to protect other people from us, as opposed to protecting us from other people. And so by you wearing a mask, you're being responsible for helping to decrease the spread of the virus throughout the community. Now the face shield is really, unless you're going to be doing close up or you're having something where you're going to be having a lot of mucus coming out, you may not need that necessarily.
Look at this.
Bishop, with the mask and the face shield,
I got my mask. And then my mask has a filter in it. It's a cloth mask, but it's got one of these filters in it, charcoal type filters in it.
Right.
Does that help any?
They all will help because they do find the purpose is to prevent you from, if you're positive from sending out your saliva. They found that if you're talking, the virus is transmitted mostly by respiratory secretions, either by talking, coughing, or sneezing. Talking, the droplets may go 4 to 5 feet, and if you're sneezing, it's going to be further than that. So if you're around someone that's sneezing and coughing, get away, because they can go further than 6 feet. But the mask is to prevent you from transmitting to someone else. So between the mask and your social distancing, that's going to help. So definitely you want to wear the mask. Now, if the mask is not going to stop you from getting the disease itself, which is why you want to keep your distance from someone.
Wait a minute, say that again, Theo. I think
you had stepped away. These two masks are masks of the N95 and the KN95 are the masks that prevent you from getting the disease and prevent you from transmitting. The N95, Dr. Jackie was mentioning your beard. This forms an airtight seal. If you don't have an airtight seal, and that's why if you're working, you have to be taught how to use this mask. It has to form an airtight seal around your face. This mask has an upper and a lower band. The bands we use and masks we use now have the ear seals. It's not airtight. This is a KN95, so it will stop 95% of viruses, but it's certified out of China. The N95 stops 95% of viruses from coming in and going out, is certified by the US. Everything else is just to prevent you from transmitting the virus. And so you're doing that to help others, but you got to stay away from people because they're going to give it to you, and the mask will not prevent you from getting it if you're around in close contact with a COVID positive person.
So even these surgical masks do not prevent you from getting it.
Well, they did an interesting study, and they found that the cloth masks actually are better for prevention of transmission than the surgical mask, because the surgical mask has some air coming around. Anything you wear is going to help you. But they found that they did a study looking at they had people cough into masks, and they found that more viruses got through the surgical mask than the cloth mask. The surgical mask is really more to prevent the surgeon from transmitting his mucus onto the patient and to prevent splashes. So the cloth mask probably work a little bit better than the surgical mask. But anything you wear is going to help you is better than nothing.
So the takeaway here, Bishop, is that when you wear a mask, you are preventing other people from being exposed to what you might have. But you're not, with the cloth mask, preventing yourself. When you are preventing yourself from getting anything, it's social distancing, it's washing your hands, it's using sanitizer. but you are not, the only way to really prevent you from getting something is isolation and social distancing and using good hygiene.
What
Dr.
about if we walk
Reed,
around
one
in
of
a
the
plastic bag?
questions, I'm going to cut Bishop off.
He has
You
multicolored
know, I'm
masks.
prepared.
Dr. Williams, all of this is overwhelming for a lot of people. So how do you cope with having to social distance and wear a mask and can't see your family? What are some of the things folks can do with as far as coping?
Well, it's these are unprecedented times, and the last time we had a pandemic was probably over 100 years ago. So most folks who survived that are, we're hoping they're seeing Jesus now, and so this is very different from those. Of course, times are different, but one of the things, or at least some of the few things we recommend for people to do, one, take care of your body, meaning whether it's exercising, proper nutrition, with regards to a well balanced diet, getting adequate sleep as much as you can. I know it's been difficult, especially over the weekend. With it seemed like every night there is some new development, breaking news, and most folks sort of get sucked into what's what's happening, but we also recommend you minimizing the amount of news and your exposure to the news. It's important to keep updated on um, information that's happening, but I don't think it's beneficial to sit and watch CNN or your local news coverage for 24 hours a day and all of those things. That's not really healthy. um in addition to that, even though you're going to be missing your loved ones, this is an important time to sort of connect with them. Folks that you haven't spoken to or seen. We have a lot of technological advances with regards to Zoom teleconferencing or FaceTime, or and even if you don't have access to the video, you can basically pick up the phone and call up on not only your loved ones, but your neighbors or other people who we are in vulnerable populations, the old lady down the street, and so those are the folks you still need to check up on, just to make sure that that they're okay. Another thing we also recommend to do is sort of take breaks for yourself. There's a lot, and especially with regards to the recent protests, and watching all the videos with regards to what's happening in and around the country. There's a lot of emotions that comes along with that, whether it's anger, whether it's rage, whether it's feeling sad, whether it's you know a lot of times folks are being re-traumatized every day, not only from your own experiences, with regards to interactions with police, or or feeling that you were singled out because of the color of your skin. So we have to be mindful of that as well. And in addition to that, it's also recognizing that you can always seek help. Seek help. Therapists and psychiatrists are available. We've been seeing patients through telehealth. So, that's been a good thing. We're hoping that the federal government continue to allow insurances and these services to be available, so that we can have increased access. And so those are the things. And also obviously, everybody know themselves individually. But if you starting to feel, like you're down and depressed and sad and anxious and can't handle things, talk to your closest relative, and then you can also, call 911, and, you can go to the hospital. We don't want folks, who are feeling suicidal, not necessarily wanting to go to the hospital because they're afraid of getting COVID. That is legit, and there are designated psychiatric emergency services that's away from the main ER sometimes, in most cases, and so you wouldn't have to deal with what may be going on in the main emergency area. So I can't hear.
Unmute, Jackie.
There's a question about whether or not it's safe to have dental procedures done. Dr. Stevens or Dr. Edwards, either?
It depends on your dentist, because some dentists are not doing them, and some are able to do them because they have their personal protective devices, and so it depends on your dentist. It's, of course, if you are negative, that's one thing, but the dentist, I guess you can ask him, members, has he been tested? Has he been negative? Are the people, the dental assistants he's working with, how often are they tested? Are they taking precautions? Most offices you're going to now are taking your temperature, they're asking you certain questions for screening, and it goes both ways for you and the dentist also. So I would ask each dentist office what the procedure is to ensure. The dentist close to our office, they were closed for about a month. And now they've opened back up, and I would assume that they're taking precautions. So I think it would depend on your individual dentist. But you may want to make sure that he has been tested negative at some point.
Both from a perspective of the dental as well as medical. If you have not been to your doctor's office recently or your dentist's office, then call ahead to make sure that, first of all, that they're open, obviously, and that they are taking patients and doing the necessary precautions, whether you're, as I said, whether it's a dentist or whether it's your medical doctor. We all have had issues with accessing PPE or personal protective equipment, like what Bishop has shown us, some of the headgear. All of those things are part of that personal protective equipment. Many of us are now stocked and ready to now start seeing patients, but I agree with Dr. Williams with respect to, it's still wonderful that we do have the technology and the ability to be able to take care of patients with the telehealth, whether it's telephone or with a video. And I think that, as has been said before, that this is a medical emergency, and the availability of telehealth has been a lifesaver for a lot of people. And we expect that we'll be able to continue to do telehealth even after this emergency, but certainly through this emergency, that we will have that kind of access available to everyone.
So Dr. Fulton, people still have a number of questions around, again, testing. And one of the parts of it is, what if I have tested positive, but don't have any symptoms? What do I do after quarantine? Am I still contagious? For how long? How do I know what to do next?
Someone that has tested positive, let me make sure we have the question right, and they have done the 2 weeks or 10 days of quarantine, then they want to then be able to go back to work. And the question is whether or not they need to have another COVID test before they can go back to work. And that's where we are saying that people need to check with their doctors, and also with their work, in terms of what their criteria are in terms of trying to protect everyone in the office. But the CDC, as my understanding, is that if you have quarantined yourself and you came up positive, you probably are going to be requested to get another test done and come up negative. And there will be some people, though, we know, that will continue to be positive. And I think that as long as you're positive, people don't know if you may be asymptomatic and still shedding, that's where we're still telling people wear the mask. And if you are able then to go to work, make sure that you are wearing the mask because you don't want to expose people to what may be asymptomatic, but still a positive person.
How often should
So
people?
Dr. Edwards, you're saying that you can have the virus and not have any symptoms.
Absolutely. Yes. And be shedding. And that's why we need to have the mask on to protect others. I'm sorry, Bishop.
How often should persons get tested?
I would say ideally, if we had enough tests, you could get tested as often as you needed to. Because if you have the test today and it's negative, you can catch the virus tomorrow, the next day. And so there's no guarantee. And so because initially testing was unavailable, they actually limited testing just to very symptomatic persons. But a lot of things we didn't know about this virus. We didn't know how long it's, the current recommendation is that you stay quarantined for 14 days. But we don't know how long you can pass the virus for. Currently, some people are getting those antibody tests to show that you might have had contact, but we don't know what the test means. We don't know if you're immune to the virus once you've had it. They just don't know. And so all of this we'll find out as time goes on. And so you may want to get tested if you maybe once a week, depending on where you are, depending on if you can get it done. But again, there were limited tests, and so often the tests were done only for symptomatic persons. As more tests become available, you can get hopefully get more testing done.
One of the things, if you're positive, is going to be reported, and people need to understand that you're going to be reported to the health department, and there's something called contact tracers. So what's that? Somebody speak to that, contact tracing? Dr.
Go ahead.
Dr. Stevens, that's fine.
Contact tracing is basically, if you're positive, they need to know who have you been around for the past 14 days, because the current studies show that the virus may take up between 2 and 14 days to show symptoms. So you may have been shedding the virus for the past 2 weeks. And so they're going to try and ask you, who have you been around for the past 2 weeks? And of course, not everyone knows that. There's been some controversy because they have an app out that some people would use to, I guess, if you go around someone, they can tap their phone and show you've been somewhere. Of course, not everyone wants everyone to know where they've been for the past 2 weeks. That's kind of up in the air. But contact tracing is tracing those who you've been around, testing them. If they're positive, then you trace who they've been around. And the goal is to find anyone that's positive, quarantine them. And if you quarantine all the people that are positive, that way you can slow the virus down until the vaccine can be found. And so that's called mitigation, try to mitigate the virus by preventing yourself from getting it. And then hopefully anyone that you find is positive, you put them in quarantine for 2 weeks and stop them from spreading.
One of the things I want to make clear is that if someone calls you and tells you your test is positive, you do not have to give them any information, your social security number. So people asking you for all that, that's a scam. The health department will not call you and ask you for any extra information. They have all they need to start the tracing. Okay.
Yeah, I wanted to just.
If there was a question that came in regarding questioning about testing, and it stated, why must Questar require invasive questions to get test results? Can anybody speak to that?
I guess the question is, how invasive are we asking? And what was the specific lab? You said Questar?
It said Questar.
If I'm not mistaken, I think what this may refer to is, in many of these labs, you have to get a login. You have to sign in to their system. And a lot of the questions are not related specifically to you getting your results. It's related to you being able to sign into their system. They ask all these questions before you can get a login in their system.
Okay.
Okay.
Because currently what the health department is doing is they're trying to collect data by gender, by race, so that we can look to see what happened with this pandemic. So they are going to ask you that information now. Dr. Williams?
Say that again?
Oh, I thought you were. There was some question about why do we have to do nasal testing since it's so invasive?
It's so uncomfortable, but it is the first test that we had available and widely available. I just read last night about the instant test breathalyzer that is being done over in Europe. And well, they're not in Europe, but they're looking for the FDA to possibly approve it so that it's available by September. We would all hope that everyone that's out there working on a vaccine, working on a treatment, and that they will be able to move these things fast. But just to let everybody know that it is not easy to develop a vaccine inside of 3 months or 4 months, as our White House would try and tell us. The fact is that there have been vaccines that have been developed and they take years to develop, not just the development of it, but then to test and see once somebody has, if they have a vaccine and they're given a shot, then we've got to wait months to see whether or not that person might be exposed to that virus again and whether or not they will be able to resist it. And that's not something that can happen inside of 3 or 4 months. It could take a year or more years for it to happen. And so developing a vaccine, the hoopla that people are saying that they don't want to give us a vaccine. Yeah, we want to give you a vaccine, but we want to give you something that's not going to cause more problems than it prevents. And so you've got to give the people time, and it's just not something that can happen overnight. In the meantime, we need to make sure people understand that until we have a vaccine, all the social distancing, isolation, and wearing a mask and 6 feet apart or more, especially when you're inside, you need to have that social distancing in place and anticipate that this is going to be something that we're going to need to live with for more than just December. We're talking about next year and maybe the year after.
There is a question as it relates to virtual doctor's visits. We know that a lot of people have been a little hesitant about going for their regular checkups, etc. Now that we have virtual visits, the questioner wants to know, how can they be best prepared for a virtual doctor's visit?
I can tell you that because we've been doing a virtual doctor's visit since the end of March. You need to have, first of all, hopefully you have some type of device, either a phone or a computer or a laptop or tablet that can do video. However, Medicare will allow us to do audio only visits for the same cost as a video visit. You want to have a scale, and if you need to have your own high blood pressure machine, so when we call you, we can get your blood pressure results. You need to have, we have our nurses call you ahead of time. You go through your medications, make sure all your medications are up to date. And then we go through all the questions, just like an office visit, except we cannot check you. Now, I've had people call me with rashes and swelling and physical ailments, and I've been able to have them take their phone and point to the rash or take a picture of their eye, take a picture of their leg, and make diagnosis from that. So we've been doing that since probably the end of March, and probably thinking about maybe by next week having some people come into the office. Some still do virtual, especially the elderly that are afraid to come out. So as much information as you can give your physician when he calls you, it makes it more helpful. If you're coming in for a blood pressure follow-up and you don't have a machine to check your blood pressure, especially if you have high blood pressure, you need to have your own machine. If you're diabetic and I call you and say, what's your reading this morning? I didn't check it. Okay, well, what do you want me to do? So you need to be prepared with all your information that's specific to your condition. So when we call you or do the video chat, we can give you the best information for follow-up.
Dr. Williams?
The same. It's been pretty seamless with regards to going to the virtual visits. A lot of some of my patients who, don't have this what I will call, I guess, the smartphones now. To do the video, we I call them, and basically the sessions go seemingly, but like Dr. Stevens mentioned earlier, it's important, as far as, doing what I call the regular health maintenance things, knowing, obviously if you have underlying conditions, whether it's your blood pressure or um, the importance of having a scale, because obviously, knowing your weight and changes in weight, that's important. That signals a lot of underlying health things. And even people who are depressed and anxious, they're not eating, they're not taking care of the other things. So noticing those subtle changes, because that's one of the things I always ask, my patients, how is your diet, how are you eating, how are you sleeping? Those, I call them general things, wellness things that are indicators for other health conditions. So
On that issue too, we're primary care, Dr. Stevens and I. We do know and want to encourage people that if they have been putting off on having a procedure done, surgery done, those doctors are also doing telehealth and will do as much as they can with the telehealth. But I think that people need to be aware of the fact that our surgical colleagues have been the leaders in terms of getting us back into the in-office visits, because they're very accustomed to gowning up and being very sterile in terms of their procedures, and the hospitals are prepared to do that. So if there's something that you have been putting off being seen for, the hospitals are very much ahead in terms of moving forward and making sure that infection is not a stumbling block or something that keeps you from getting the care that you have been putting off for the last 3 to 4 months because of COVID. And they're getting those procedures done. And there are a lot of other physicians. Clearly, you need to see your ophthalmologist, and you can't quite put your eye up to being able to completely be examined, but there are things that they can do. The dermatologists are seeing folks as well. And we know that the pediatrics, I'm sure, Jackie, you know about that a lot of folks have put off getting their kids getting their shots. We need you to get your immunizations. We need to catch up with that, because otherwise we're going to have a resurgence of some other childhood diseases that we didn't need to have, because we don't need to have another outbreak of, because people have been not wanting to go to the doctor. And you can't get a shot by telehealth, but you do need to know that we're doing the things that we need to do in order for you to be safe and be able to get those routine immunizations and shots.
One of the
The
things I'd
question
like to
was,
speak to about immunizations in pediatrics, we're asking parents of kids 4 years old and less to make sure you make in-office visits, because we got to get your shots in. And then you have the 11 to 14-year-olds who really need their shots. Some of the diseases, measles specifically, that we're trying to prevent are even more contagious than coronavirus. So if we have a measles outbreak in this city, which we've had, it's devastating. It's devastating to a community. So the immunizations for kids 4 and less, and then your 11 to 14-year-olds need to get, and 16-year-olds need to get their shots. I don't know what the schools are going to do in the fall, but that's how most pediatricians' offices are working. Also, make sure if you have asthma that you're getting a telehealth visit in, so you can get your medications and keep your asthma under control, because you're at high risk for COVID infection. So that's just the piece.
so someone wanted to know what shedding was, Dr. Edwards.
That's what I mean. Shedding is just clearly having the virus. It's just like just having it, and you're sneezing, you cough, and that's what I mean by shedding. And even though you may not have any symptoms, but you are still, when you're close talking with people, you don't know how much you might be spreading some of that whatever virus load you might have. And that's what we mean by shedding. We know with coughing, you're going to spread it, but even by just close talking, it can be you can shed some of that virus that you're not infected by, but other people may be more susceptible and be infected by that.
So there are a couple of questions about surfaces, mail. How long can you open it? When you buy stuff from the grocery store or another store, what do you need to do when you get home?
Dr. Stevens?
They've been doing studies to try and figure out how long the virus can stay on different surfaces. They have found that it varies based on the surface. For instance, for some surfaces, it may stay for maybe 4 hours. For other surfaces, it may stay for a couple of days. Again, most of the transmission is going to be from respiratory symptoms. But again, if you touch a surface and touch your face, then the virus can get to your nose. The virus invades you through the nose, your mouth, and maybe the eyes. And so it's very important when you're touching surfaces to wash your hands with soap. Soap helps to break up the virus and disrupt it from entering your system. So wash them with soap. Again, we do know that it does stay on some surfaces. The heat and the sunlight and humidity sometimes helps to direct how long it will stay alive, but it can. Now, they have found that it may not be necessary to clean the mail because it doesn't stay on paper that long. There may be a little bit of overdoing it. So I just have to kind of use common sense, but certainly if you go into an office, you touch a doorknob, you're in the supermarket, touching common things, then as soon as you leave there, wash your hands or use sanitizer. Sanitizer can help to disrupt the virus. The best thing is soap. Soap will break up the virus, and the virus cannot attack you if you cut it off with your hands.
So Dr. Edwards, Dr. Stevens mentioned that it comes in through your nose. So I've seen where folks thought if they drink hot tea or gargle, that they can kill the virus. Can you speak to that?
And then maybe take a dose of alcohol too, right? No. It might make you a little bit drunk, but you're definitely not going to kill the virus that way.
Be drunk and infected.
Yeah.
And get more infected.
Yeah.
Yeah, uninhibited.
Speaking about surfaces, is it safe to fly on an airplane?
Well, I was reading about that just this afternoon, and part of the issue with flying, well, if you're talking about exposure to a potential virus, the longer you're in an environment where there may be people involved, the higher chance of getting exposed. So much of the exposure comes from being in the airport, being in the lines, being in the waiting area. All of that puts you at risk. Now, if you're flying, the airlines do have, again, good filters. But again, they found that if you're within 2 rows of someone that has the virus, you still can't get the virus. So right now we still don't know, but it's probably still not that safe, and they haven't shown any specific distance on the airplane that's going to make it safe. So right now we don't know. So I canceled my flight plans for the summer, personally.
Yeah.
Jackie, can we follow up on that? Can we, you all are probably far more aware of the new technologies and the discoveries that are coming out and what businesses are doing to make it possible for folk to come to stores and places like this. Do you see by fall a lot of the things that are impediments now, that there will be some way to address those impediments to make them less of a hindrance for persons? For example, like flying.
The only thing only thing about what may happen in the near future, and specifically with flying, I have my own concerns about the social distancing on the plane. We know that there's less likelihood of people transmitting it when you're in an open space. And you're able also to do, when you're able to do more social distancing, then there's not as much possibility of that, especially if people, out of courtesy, wear a mask, and then they're not likely to expose. But then you have to also add the social distancing. But when you get to the planes, I've heard them talking about them spraying it and cleaning it and rotating it, and not everybody, coming on, using the plane like one right after the other, and getting cleaning in between. but I haven't heard the airlines talk about distancing people. When this thing hit, I rode on Southwest Airlines. There were 3 of us on the plane, and there was 4 attendants. 3 people on the plane. We had no problem social distancing, but I don't hear them doing that now. They do say that you can pick your seat and so forth, and they're not going to have the middle seat. But I still haven't heard them say, but every other seat we're going to have 1 person in. Until I hear that, I'm not really feeling comfortable about about being able to get on a plane. And when it comes down to vacation, I think maybe the car is probably the better way to go. But again, it's about making sure that the people you're riding with also have been tested, and then that you're still very careful when you're in the car and when you get out to go to the bathroom and so forth, that you do all the necessary things to prevent being exposed to the coronavirus and therefore exposing your other folks that you're around with.
They had a session on TV where they talked about high, medium, and low risk. The longer the trip, the more they recommended that you go by car. Shorter flights, 3 hours and less, maybe by air. The highest risk was the beauty salon
Really?
and the barbershop. That was the highest risk.
There's no
Nails and beauty salons were even higher risk than short flights.
Right.
So I'm not sure how they figured that out, but
it's about
that was the highest risk.
Right, distance.
Yeah, well,
It's prolonged contact at prolonged close contact is what
Right.
the problem is.
right. I got my hair done. My beautician had on a shield, a mask. I had on a mask, my glasses,
Right.
and there was only 1 person there.
And if you can get it done within 45 minutes as opposed to the 4 or 8 hours that we sometimes spend in the beauty salon. Yes.
Yeah.
Ain't happening.
So Bishop, there's a question out here about what are the special precautions churches are putting in place?
Okay. Well, as you've heard the doctor say, the information is across the spectrum, and you have to figure out how you try to keep people safe. So we're implementing social when we open, and that won't be till the rate of transmission is low enough in the area that we are, I would want to say, down near 1%, 2%, 3%, something like that. We won't be opening at 5, 6, and 7 because that's too high for us a chance of transmission. Before I go to the rest of that answer, what would you say that rate is normally with the flu?
I don't know. I don't know what the stats are. Yeah.
No, I mean, because the problem is right now we don't know what the long-term wave is going to be with this virus. Right now we're in a wave, and the peak in Maryland was April the 29th. That was the peak of hospital utilization. Now, because everyone is getting out into public, we didn't know whether it's going to be a second peak. And then we don't know whether it's going to be a second wave, maybe in the fall. We didn't know if this is a seasonal virus or not. And so just like Bishop Yo was preached to people, see someone through the seasons. We have to see the virus through the seasons to see what it's going to be. So you mentioned maybe by September having some things in place, but we didn't know what's going to happen in September. So this is new for everyone. So we're kind of walking with a lot of trepidation because we didn't know what's going to happen. We're kind of basically paying it day by day. It's really day by day, week by week, month by month. There are some states where the rate is actually still peaking. South Carolina, North Carolina, the rate of infections is still going up. And so what we're looking at is, what is the rate of hospitalizations and ICU use? That's what we use, deaths and ICU beds. If that's coming down, means that the sicker patients and we can handle the sicker patients. That's something to look at. But right now we still don't know. It's kind of day by day.
So what we're doing is we're trying to get some guidance on where we are in the curve or the curves, so that we don't want to be on the front side of any curve, and we don't want to have to open and shut, open and shut, open and shut. So we want to make sure we're on the back side of a curve and prayerfully down near the bottom of that curve, so that if it starts again, we're still way down. That's first thing. Secondly, we're putting in shields in place where people would normally be talking face to someone. We're putting markers on floors. We'll be blocking off seats in the sanctuary. When I say high five your neighbor, you'll just high five. That'll be high five. You know, you'll say, hey, you know, like that. That'll be a high five your neighbor, because you'll probably have to bend halfway to China to slap their hand. So we're keeping folk distance apart. Our services will be different. We have two locations that God permitted us to have through this virus. One is 6020 Marion Drive. The other is www.newpsalmist.org and everything related to us. We're on one of our campuses right now. We will not end this campus when we go back to the building. We will still use this campus for a lot of things that we do. Why? Because we've learned this campus, we've learned God gave us this. And this is not a summer rental. We will not be turning the key back when we go back into the building. This is a new property that we will be using, exploring, and developing. So that's another piece of what we're doing, how we're getting ready. We are planning to do ministry in brand new ways that we've never done it before, ways that it's never been seen before. Why? Because we're dealing with a novel situation. We're in a situation we've never been in before. And the way I like to say it is this: what we've done well is history. What we do in the future will be copied. We will study what we've done well, but we will try to do in the future what others can copy and carry into the future. So we'll be, number one, when we do go back, we will not have 3 morning services because we cannot do the cleaning. It'll be impossible to do what's necessary to clean that facility and make it ready for the next group. Services will not wangle on, not even the 12 o'clock. We will cut our service, not cut, our services will be impactful for 1 hour. I don't want to bring persons back to a facility and back into the facility till I can guarantee that we can have a worship experience as good, if not better, than the one we're having now. If the answer to that is that we can't or we aren't, then we're not going to have a worship service that gives God less than what we're giving him now. But we know that it's going to be possible, because just like everything is being created and innovations are coming forward in our secular society to make life livable, things are coming forth in our religious experience to make this experience livable. This is a surprise to us, not God. So he has put everything in place for us to discover, to make it work while we're here. Angie, does that get to it? If there's
Yes.
anything else you think that you know we're doing, you feel free to add.
I think that speaks to it, and that is what New Psalmist is doing. We are well aware that other places are doing other things. And so I think that people, just as they are asking questions and going to their physician's offices and other places, they should find out also what is being done if they are not, not coming to New Psalmist, but going other places. They should ask questions to become comfortable to go back.
Because we will require we will require, for the peace of mind of everybody coming, answers to the same kind of questions that the doctors ask. Do you have a cold? Are you coughing? Do you have a fever? Not because somebody said, well, I came here to get healed. Then we will meet you on the telephone and we will pray the prayer of faith, and the prayer of faith shall heal the sick. But we don't want to take away from the growing nature of other people's faith, other person's faith, and have them have the fear of being exposed. Angie, would you say I'm on the right path there?
Absolutely.
I want to ask Dr. Williams before we can you speak to what are the signs of depression? How do folks know when they're depressed? A lot of folks are feeling overwhelmed, not sure if they're depressed, not sure whether they should seek care. What are the symptoms of depression?
Okay. So no, normally we think of when we think of depression, we think about a period of what we'll call like depressed mood, meaning one, you're not doing the things that you normally would do, um, and activities that you normally do or bring some form of pleasure or happiness. Those are not, you're not getting the same feeling. So if, case in point, if I like to play tennis and that's something that I do, or if I like to exercise and that's something that sort of I like to do, you find yourself not, over a period of a week or so, give or take a week to 2 weeks, you see a decrease in your feeling of enjoyment when you do those activities. Um, Not only so those are one thing. In addition, you would notice changes in sleep, um, changes in appetite. So a lot of times, some folks may find themselves either sleeping too much, more than usual, or some hardly have any problem sleeping when it's sort of when they go to, at bedtime, they're finding difficulty shutting their mind down. They're thinking about what happened today, what they have to do the next day. So there's that. They're not eating. Some people tend to, it can either be two ways. Some people tend to not eat. So there's a loss of appetite. But then you have others who, I call it stress eating. Sort of, when they worry, they just, it's sort of finding food as a comfort thing. And so then, before you know it, it's chips and it's donuts and it's, you know, all of those things that, ordinarily you wouldn't reach for, but, those are comfort things, the ice cream or something like that. And they have a lot of calories. And so you find yourself, eating more of those. In addition to that, you may have problems with focusing, just sort of concentrating on things that you normally would do. Work is taking long just because your mind is sort of like drifting away. You're not as focused. But also, in addition to that, you have low energy, and sometimes people start having what I call negative thoughts, sort of. you know, whether it's thoughts related to self-esteem, thoughts related to, um, I'm not capable, of doing the things that I normally would like to do. Um, there's a lot of like what I call self-doubt. Um, and then sometimes, those thoughts can also lead to feelings of not being, some people may think that life is better if they're not around, and if they're not here, nobody will miss them, or they don't want to be a burden on family and those sort of things. So those are some of the symptoms of depression, and a lot of times if those continue, they can also lead to psychosis, where people start hearing things or seeing things that only they can see. And so those are some of the symptoms, when obviously we don't want you to get to the point where you start having thoughts of your life is not important or you're not valued. And so it's sort of, we would advise and highly encourage you to, talk to family members, call in this area, the Baltimore crisis line. You could call 911 or even 311. I think it's the information um, center. And there's even a 711 that you can text on your phone, and that's the suicide hotline. And they're available nationwide 24/7. So there's always someone available that you can reach out to and speak to, and of course, obviously your regular physicians, but we would rather you talk to somebody.
There has been an uptick in domestic violence as well as child abuse during this COVID. And those folks do need to reach out also, and those numbers are available to them also.
Jackie, can Doctor speak a little bit to one of the things I'm seeing in from a pastoral vantage point, and even from a staff manager's point? And incidentally, we are developing a church plan, a complete plan for our move in. But here's my question. What do people do who are now confronted with these multiple roles that they have to play at home, and the terrible sense of inadequacy, and that they are not providing everything that their children and family need? And I'm dealing with folk who are wrestling with feeling inadequate.
Yeah, so it's okay to feel that, of course, in the midst of this pandemic, parents have basically become teachers. I mean, not that they weren't teachers at home to begin with, but they're taking on the role of being academic teachers in a lot of ways. And of course, now the way things are taught are a little bit different than prior generations. So there are issues with regards to how kids are understanding things, and parents learn things one way and the kids are learning it in school another way, which is another challenge in and of itself, especially with regards to the math and those things. So I encourage, especially, people feeling, that they're inadequate, to seek assistance. They are not the only ones that's dealing with the same circumstance. With regards to your kids, the teachers, for the most part, are home quarantining. So it's their job, so the parents should be able to have access to them, to at least get additional, if your child needs additional assistance, then you can facilitate that however they're going to do it, since the teachers, for the most part, are home quarantining too. And then with regards to helping, whether it's other family members and those things, the help, or at least getting help and knowing when you need help, is also important, because that's the only way you don't find yourself feeling overwhelmed with anything. And of course, obviously, reaching out to your supports, whether it's the church group and other family members. I think those are our natural support systems, and a lot of times people don't utilize them as much as they should.
Could I just chime in a little bit with that? I think one of the things that we have to be mindful of, just as when we're on the airplane, the stewardess tells us, if we're flying with children, to put on our mask first. Mm-hmm. And so I think that we have to be mindful that we cannot give out when we're depleted. Sure. So self-care is a must. It's okay to be a little bit selfish in this time, to take some time for yourself, to take care of yourself, to say to family members, I can't help you right now, but I'll get back to you later. Or to be able to say, I'm sorry, I just can't do that right now. If you're not taking care of yourself, you cannot take care of others. So, you know, we're not going to be able to do everything 100%, and we won't know how to do everything. So, as I was sharing with someone the other day, be kind to yourself. Don't beat yourself up when you fall short, especially in this season.
One of the things I wanted to mention, a lot of times we need resources and we don't know where to go for them, and that makes us stressed out. Dr. Let me say her name right, Letitia Jasrasis, the Baltimore City Health Commissioner, has a wonderful website. Look at Baltimore City Health Department website. Today, she sent out her newsletter, and it has something called Charm Care. If you go to that, click on, it will connect you with all kind of resources, and she's still updating it. Has to do with housing, food, transportation, education, work, utilities, finances, mental health treatment, substance abuse treatment, and safety. I mean, it's just, you just put the zip code in and the resources come up. And I just want to put that out as a resource because a lot of people are unemployed and they need food, they need shelter. Baltimore City, I didn't realize this, but they also have Lord Baltimore Hotel, where if you are not able to isolate at home or quarantine at home for some reason, they'll put you up there. You just have to go through your doctor. You can self-refer on that website. There's a phone number for that because some people aren't able, because of their housing situations, able to quarantine at home. And I think they provide the food and everything else during that quarantine.
Jackie, where do they find these resources?
Just go to the Baltimore City Health Department website. But if you want, you can just Google Charm Care, the word Charm Care, and you can see the resources. But they have that website, coronavirus pulls up and then the resources are there.
I think that's so important to have that information, Jackie. Not just during coronavirus, but like we know, the coronavirus has ripped the Band-Aid off of healthcare. And those are the kind of resources that we have needed in our communities forever. And so it would be good to know that that is available not only now, but going forward, because there are so many ways that healthcare is impacted by the social determinants of health, whether you're talking about food deserts or our education and employment and being able to get insurance and access. So having resources for services, key to having better healthcare for all.
Also at that website, she's also dealing with the racism. So she has some articles that are on there, which are excellent. One's called Levels of Racism. It was written 20 years ago, but I think they're trying to address what's happening with the Floyd situation as it impacts healthcare. And I know, Bishop, you had the Town Hall for Justice where the church has started to address that.
So we've had a wonderful night of conversations, many questions, and hopefully we've answered most of them. We thank all of our panelists tonight and our moderator. So Bishop, I'm gonna hand over to you.
I was pulling up that website. Jackie, you says Charm Care, not Charm City Care or
Charm Care. But if you go to the Baltimore City Health Department, this is a newsletter she put out for the doctors and the healthcare providers today with that as a resource. So I'm hoping it's already up, but it's called Charm Care. And when I clicked on it, I went on to see what was on it. And you don't even have to put your zip code in, but that it's called Charm Care.
Okay, we may also have someone from our staff. I may ask Sister Kelly to give you a call to write up some of this so
Okay.
that we can put it out, or she'll
Okay.
put it out in one of our weekly email blasts
Mhm.
to the congregation.
Okay.
So these resources get identified to the congregation. So I know Kelly's sharing with us now. So you'll probably get a message soon from Kelly
Okay.
Alexander about this.
All right.
I mean, I just can't shout enough. I know some persons had wondered, is the virus that we're dealing with the same one that they had in China?
Yes.
Mhm.
So this is not something else. This is that same one.
This is the one, yeah, it spread internationally. Yes, it's the same one. It didn't change when it got to Baltimore.
One of the things I want to make sure I mention is there are a lot of people who have lupus who are on the medication that the president supposedly took for 2 weeks. That is not a preventive. So I just be real clear to folks who are on that medication, you're not any safer. It won't keep you from getting coronavirus. As the president used it as some sort of preventative, but it's not.
And actually, Dr. Fulton, the FDA announced today that they were rejecting it as and removing the temporary as far as allowing it as a treatment. So it is no longer allowed as a treatment for COVID-19.
Good.
Just so we get this straight for everybody, would you answer yes or no to the following? Anybody can jump in. There is a vaccine that is currently in use that can ward off the virus.
No,
No.
All at once?
No.
no.
There are tests being done that on vaccines, and we probably will have one that we can take in the fall.
No.
First part, yes, there are tests being done. Second part, probably not by the fall.
There are medicines that we can take, we can get from our doctors that can cure us once we get the virus.
No,
No,
And even the medicine that they were giving shortens the course, doesn't cure the virus.
remdesivir.
Correct.
Right.
Doesn't
The way to heal from the virus is that your body has to heal itself.
exactly.
Yes.
Yes.
Okay, so I hope everybody got that. So number one, get your body in as best shape as you can. Because if your body's in bad shape, it's not going to have a good time trying to heal itself. But the only way we can right now, there's nothing out here, either from China, Japan, Thailand, or Brooklyn, that can cure you once you get this.
Correct.
Your body has to fight it off.
Absolutely.
Yeah.
Right.
Okay.
So remember social distancing, wear a mask, and wash your hands.
Wash your hands.
Wash your hands.
Anything else anybody want, any final tip anyone wants to give? Because I mean, we may not have another opportunity to have this kind of high-powered conversation. And I would invite those who have questions and you didn't feel they were answered, send them to us at amen@newpsalmist.org. Amen, AMEN, @newpsalmist.org, and we'll try to get answers for you. In fact, we'll try to have an ongoing answers for you.
I would just like to encourage everyone to get a primary health care provider. Because if you notice, everybody kept saying, call your provider, call your provider. And even for mental health, there are mental health providers. Even if you're uninsured, you can get health care. There are community health centers that are here in this city and in the state that if you're uninsured, they are obligated because they get federal money to provide health care to folks. So no one should be out here without health care or without a resource, whether it's mental health or physical health. I just want to say we have three kinds of health. We have mental health, physical health, and spiritual health. Okay. If your mental health and your physical health are not, if your mental health and your spiritual health are not okay, your physical health is going to be screwed up. Just want to say.
I would just like to encourage everyone to get a flu vaccine in the fall because the virus comes back and you're trying to fight off the flu, you're at higher risk for catching the virus and for developing other ongoing conditions. So I would encourage you to get your flu vaccine when it does come out.
Should you get a pneumonia shot too, Theo?
Yes, there were 2 pneumonia vaccines, but right now they're currently recommending one. If you're a diabetic under 65, you should have it's called a pneumovax. If you're over 65, you should have a pneumovax 5 years after your first one. So everyone over 65 should have a pneumovax. You usually only need it once, unless you have severe lung disease. So call your doctor, get a pneumovax, along with your other vaccines, shingles vaccines, tetanus, Tdap tetanus, and Tdap vaccines also.
And if
These
you're
are
over
up-to-date
65,
vaccines.
if you're over 65, there's a high dose flu vaccine that you're supposed to be getting. It's a different flu vaccine if you're over 65. So.
Oh, really? I'm gonna get that in my other arm.
And Bishop, my last word is we are taking new patients.
All right. Listen, shameless plug. I was about to say, are y'all taking new patients? But now Jackie mentioned that about getting a doctor. Do not play that cheap. Your family will want answers. You will want answers. And the only way to do that is to make sure you have somebody monitoring your history and taking care of your medical history and your body. So I'm encouraging everybody, you call them, shameless plug. Y'all want to give the name of your practice and the phone number?
Doctors Edwards and Stevens, 410-284-5210. 410-284-5210.
Let me write that in 410.
284-5210.
One of the other things I want to say, and I know it's, is to make sure that you are in touch with your doctor and keep your medications filled. That's one of the things we ask people to do is get 2 weeks worth of medication, but a lot of people are still in their homes. If they're 65, they're scared to go out, but you need to stay in touch with your doctor, get your prescriptions refilled, and take your medication. Especially if you have the comorbidities that make you at higher risk for coronavirus and the flu.
And particularly for Medicare patients, we can take new patients even over the phone, telephonically as well.
All right. Dr. Williams?
Yeah, so me and Dr. Fulton are at Total Healthcare, and the number is 410-383-8300. And encourage everybody to, get involved in self-care.
All right. Well, do not neglect your spiritual health.
Okay.
The church is doing everything we know how to make sure that your quote unquote prescriptions are being sent to you regularly. Remember this, you are fearfully and wonderfully made. God did not make any junk, nor did God make this in a season that he was unprepared for. And so he's preparing you. God has not given you the spirit of fear, but of love, power, and a sound mind, which means think, which means use your mind, your best mind, and believe God that he is with you. Stay in touch with him. Build your relationship with him. Your spiritual health is dependent upon the quality of your relationship with God. So develop it. Every moment that you have, spend it in connection with him. And I share this with you. Tomorrow, look outside. Go stand on your porch, or go stand in your yard, or just do like we did when I was growing up, lean out the window. And notice that while all of this is going on, the marches, the the virus, the spread and whatever, the earth is healing. The earth itself is healing. There's less smog in the air. You haven't heard the news commentators say one time that the smog alert is out. People have to watch for this or that. As Dr. Jackie mentioned, she's put gas in her car once, me once. So we're keeping down the smog. I looked at the grass in my neighborhood on Saturday. I don't know when I've seen grass look that pretty. And it's not because of rainy season. It's because the earth is healing. Not that we're going to get rid of climate change, but God is using this time to do some healing in the earth. And if God is using this time to do some healing in the earth, understand he's using this time also to do some healing in you and do some healing in me. Take your burden to the Lord and let him begin the healing process. Last week, I heard somebody say something that I found to be most instructive and beneficial. And I want to say it in the positive. What you reveal, God can heal. So reveal to God what are your issues and watch God begin to heal them. And then celebrate that you have been given this opportunity in this pandemic to become greater than you were before. And watch your body then begin to heal. Watch your mind begin to heal. And watch yourself say, thank you, Lord, for who I have become. Angie, Jackie, thank you all so very much for guiding this. To my special doctors, thank y'all. You have made my day.
Thank you.
And so we're going to close out in prayer.
Yeah.
Tomorrow night, 7 o'clock, I'll see y'all on the prayer call. No, I'll hear you on the prayer call. Father, in Jesus' name, we thank you for what our ears have heard and tonight what our eyes have seen. We thank you for persons who are positive in the midst of that which is negative. We thank you for those who come with light in the midst of darkness. We thank you, oh God, for those who say there is an umbrella for the rain and yet stand in confidence that we will make it through this dark night. Lord, we thank you for hearing us and knowing when you have to put your arm around us and still us and then steel us so that we're strong enough for what we face. Thank you for every one of our participants that came on tonight, for every question that they asked, every concern they brought. And thank you, God, for the Church of the Lord Jesus Christ, the healing station, because tonight we declare some people are healed. The hurt they brought is healed. The fear they brought is healed. The worry they brought is healed because they have received the information you would want them to know. We give you glory, honor, and praise as we go forward now to do greater things. In Jesus' name, amen.
Amen.
Good night, everybody.
Good night.
Thank you, everyone. Thank you so much.
Thank you.